Thank you, Mr Deputy Speaker. Now, this bill implements the minor amendments from the government's response to the Phillip Review by strengthening integrity measures across Medicare, pharmaceuticals and therapeutic goods. It equips regulators with stronger powers to tackle fraud, unlawful products and the growing threat of vaping. In fact, for those wanting the detail, Schedule 1 of the bill aims to improve the enforcement of Medicare integrity by, first of all, changing claim timeframes for bulk billed Medicare and dental services from 2 years to 1 year, broadening investigative powers to ensure they can be used across health benefit schemes, streamlining the pharmacy approval processes and providing greater oversight powers to obtain information about potential non-compliance. Schedule 1 also proposes amendments to the Therapeutic Goods Act to better manage and alleviate the consequences of medicine shortages. Critically, and what I want to focus on today, is Schedule 2 of this bill, Schedule 2 and Schedule 3 of the bill, which strengthen our legislative action against vaping by closing loopholes, strengthening enforcement and harmonising laws. The widespread availability of illegal vapes remains extremely concerning. I was in this parliament when we passed legislation during the last parliament in relation to vaping, but clearly it is not working and much, much more is needed. It's emerging as one of the major public health threats to Australia and to our communities. Those tobacconists are popping up within 300 metres of schools all over the place in our areas and communities, and it is unacceptable. Regularly, I hear from parents, carers and other members of the community about the increase of number of these tobacco shops that are popping up just everywhere. I've talked about it to local government level and they are powerless about it because it's not a change of use, and so we need a strong direction from the federal government to do something about this. My independent colleagues at state level are pressing the state government to do more to stop these tobacconists popping up everywhere, but we have to do something. People are alarmed about how this can continue to occur, especially in such close proximity to our schools, parks and childcare centres. It is clearly a targeting measure from the tobacco, from vaping and illegal tobacco. Australia has a strong history in tackling public health issues. For years, tobacco use continued to fall. The measures had worked. In 2001, about 1 in 2, so 49% of people in Australia, had smoked in their lifetime. 20 years later, by 2022-2023, this had reduced to just 1 in 3, 35%, already a great outcome. But we need to keep pushing that to do better. This was possible through world-leading measures such as plain packaging, advertising bans and the tobacco excise. Unfortunately, we have let it's rebuilding. The tobacco companies have invested, moved into the vaping space, and what we're seeing is now an attack on health that is incredibly concerning. Vaping rapidly filled the gap, and there is so much misconception in our communities about vaping that there's a number of measures that governments need to do. So vaping they've read the consumer and the marketing playbook. Marketed in bright colours, sweet flavours, sold illegally in rapidly emerging tobacco stores around the country. According to the Australian Institute of Health and Welfare, nearly 50% of Australians aged 18 to 24 have tried e-cigarettes and vaped. Among 14 to 17-year-olds, vaping has tripled in just 3 years. This is a massive problem. Despite the 2024 vaping reforms, the black market remains rampant and the gap between legislation and enforcement continues to erode our public trust. There has to be more that is done at a border force point of view and then a policing and implementation. So this bill introduces minor amendments that align and add greater clarity to the existing vaping reforms. These are important, progressive steps, but they must be matched with so much more. They need national enforcement, penalties and education. The wider issue here remains protecting young Australians from addiction. I actually recently had the opportunity to speak to some of our area commanders from a policing point of view, and there was a real concern about lack of resources to properly police the tobacco concerns. We need implementation of greater accountability for retailers and distributors who continue to sell vapes illegally. Consideration of a nationwide licence for tobacconists with stricter compliance and oversight requirements. Strengthen penalties to deter the illegal behaviour and properly resource and staff policing and enforcement capabilities. Further, we need more transparency, data around who is being provided with vapes and reporting enforcement outcomes so communities know that action is being taken where it is needed. We need education campaigns in schools, in workplaces to counter this industry marketing, and we need to protect children. Too many do not think of vaping in the same way as they think of smoking. They do not understand it is as bad. This is as bad to your health, to your community, to your children. So the youth vaping education campaign in 2024 was good, but it must continue in our schools and it needs to be amplified. Where is the national campaign on our screens telling people not to vape, that vaping is as dangerous and as harmful to your health as tobacco? In the past, we've had strong anti-smoking campaigns to help educate Australians around those health risks and warnings. Where are the similar vaping campaigns? They are just missing, and this is a spot where the federal government must step into that responsibility. In fact, I had a meeting that was just so sobering with a young Warringah-based scientist, Andy Thorpe, an amazing young woman. She's been identified through STEM projects and she's doing the most incredible research, but it was just so horribly sobering. She's studying third-hand vaping. Now, and I would question how many people realise vaping leaves a residue where you have vape. So if it's internally in a car or in your house or in any room, it leaves a residue on every surface. And if a later person or a child, or for example, you've vaped in your car thinking you're doing it before picking up the kids from school, it's safe, you're not giving them any kind of second-hand smoke. And then you pick them up and maybe you pick them up from childcare and you put the baby in the car seat. And in that car seat, they will then maybe touch the surface of the car around them or the surfaces in the car and maybe put their fingers in their mouth. That is third-hand impact. And what they are seeing is that residue is incredibly toxic. And so not only is there a danger of first-hand vaping, second-hand vaping of those around you, but third-hand where it's left a residue in the place where it has been consumed. And what it's showing is that the chemicals linger on surfaces, impacting lung function and immunity, and even in situations of pregnancy, that can have an impact on the embryo. So this is incredibly toxic and incredibly important that we quickly counter that with information. The government urgently needs to do a national campaign to warn against the dangers of vaping, and the chemicals included. Andy's research shows that vaping harms extend well beyond the individual user, and this is so widespread. It affects our homes, our schools, the wider community. It really is a health menace. The government's actions with this bill are welcome, but so much more needs to be done to ensure that vaping does not entrench itself like tobacco has done in the past. Otherwise, we'll continue to see the health costs and harms escalating, and communities will lose faith in the government that they have an intention to protect health and the health of our communities. So, on the whole, the amendments of this bill are a welcome step in the right direction, but the stakes are high. I can't stress it enough. Laws alone are not enough. We must match legislative reform with enforcement, education and a nationally coordinated campaign if we want to protect young Australians from addiction with vaping. I commend this bill, but urge the government to show much greater ambition when it comes to tackling the scourge of vaping, because nothing is more important than the health of our children and our communities.